Welcome to Straight Talk with My OBMD podcast. Join me for a bi-weekly discussion on topics most relevant to women's health today. We are your source for medically accurate, real-world advice and all things related to your health and well-being as a woman. From menses to menopause, we've got you covered. I'm your host, Dr. Dana Smith, a fully practicing, board-certified OBGYN physician with close to 20 years experience. I am also the founder of the website that is 100% dedicated to women's health, myobmd.org. At myobmd.org, we write on all aspects related to women's health. Listen to our podcast, visit our website, subscribe to our newsletter, and follow us on Facebook and Instagram, myobmd.org. Welcome to another episode of Straight Talk with My OBMD. I'm your host, Dr. Dana Smith, and I am so excited to have with us today Dr. Loida Bonney. Dr. Bonney, full disclosure, guys, Dr. Bonney is a very, very dear friend of mine. We have been friends now for several years. She is my fitness buddy, my coach, my prayer warrior, you name it, right? Dr. Bonney has just been, she's really just been there for me and my family. We love her so much and her family as well. We're going to be talking today about the power of prevention. We're both physicians, both board certified physicians, and this is a topic that came up on one of our walk-in running sessions. We're just talking about, just how important it is for prevention and just how little time is spent on that topic. And so we wanted to be the voice of change to bring about the power and let everyone know about the power of prevention. First, let me introduce Dr. Bonney properly. Yes, she is my very dear friend, but that is not what qualifies her to be an expert on Straight Talk with My OBMD. Dr. Bonney is a phenomenal physician. She's an internal medicine doctor. She also has her master's degree in public health, and she's just really passionate about policies and patient care, not just on an individual level, which is extremely important, but on a policy level, on a systemic level, like how is the system helping the patient? So as you can see, I cannot shut up about Dr. Bonney. So I'm going to pause for a minute and give her the opportunity to tell us about you, Dr. Bonney.
Oh, wow. Dana, Dr. Smith, I just want to thank you for having me on. I will tell you that I am honored. I almost feel obliged to introduce you back, right? Because you're the great one here, and I'm so thankful. But to tell you a little bit more about myself, I grew up in Brooklyn, New York. Parents, very humble beginnings, immigrant parents from Panama, Central America, Caribbean roots. And a lot of my perspective is certainly shaped by that, also shaped by our lack of access to healthcare for some time during my life in early childhood. Um, so I'll tell you that. And then I'll also tell you that I have a beautiful family. I have three wonderful children, a husband of 22 years, and all of that shapes my perspective. Dana, I think she hit the nail on she hit the nail on the head when she talked about my educational background. Um, if you want to know a little bit more, I can tell you that my public health training is in socio-medical sciences, that I have an interest in HIV medicine and practiced that for a while before turning over my career to full primary care. I've been practicing private practice primary care for the past, I guess, so I would say 15 years in the private practice setting, and prior to that, I was in an academic setting. I just look forward to having this conversation with you, Dr. Smith. Thank you for having
Same
me.
here, same here. So let's talk about prevention and what does that mean exactly? We do so much prevention, right? When we get in the car, we put on our seatbelt. That's a preventative tool, right? When
Mhm.
some people take a shower, they put safety mats down so that they won't slip in the shower, or we put those are all preventative tools that actually does work to help prevent accidents and injuries. So on the medical level, let's talk about for the patient, what does it mean when we say to them, hey, this is actually one of, if not the most powerful tool in your tool belt, is the power of prevention. What does that actually mean on a patient level?
Wow, wow, wow. Such an important topic, such an important question. I'm so glad that you raise it and you started the way that you do. Prevention is about who you are, where you are, and what you decide to do, right? And I think that um, right now we'll focus a little bit on our own personal choice, but I want to say upfront that our choices are not the only the only variables that go into preventing illness, disease, and death. But we can start out talking about on a patient level, what can we do? So when you step into a doctor's office, or even before you step into a doctor's office, you can start to think about prevention. Like what tests can my doctor order, for example, to help me to prevent more advanced disease? What should I be screened for?
Mhm,
And quickly what comes to mind for us as women are things like mammograms. And so for men and women, there are colonoscopies to screen for colon cancer. There's prostate cancer screening, the PSA level that can be
mhm,
done. Those are some of the things that we ought to be thinking about. Even beyond that, we ought to really be thinking about our diets.
mhm,
What do we put into our mouths before we stepped into the doctor's office, before
mhm,
we took on that role that particular day as patient, right?
mhm,
Because from day to day, we're not really calling ourselves patients, right? We take on that role when we step into the doctor's office. We are citizens and we are stewards of our own lives. And so
mhm,
what we decide to do from moment to moment constitutes prevention. The
mhm,
people we surround ourselves um, with,
mhm,
the foods we eat, the air we breathe,
mhm,
the music we listen to, right? The
mhm,
television we watch, the
mhm,
podcasts we participate in, right?
mhm,
All
mhm,
of this is around prevention.
mhm,
But coming back to patients, as a patient, when you're thinking about prevention, you want to think about what can my doctor recommend for me, or what can I advocate for my doctor to order for me that's going to play the role of preventing advanced illness and disease and death.
mhm, mhm. And that is super important. Thank you for stating that, what needs to be ordered. I want to back up for a minute for the listener and just kind of take a big, like, a kind of a global view.
Mhm,
Why is it so important that this prevention, like, just on not even for an individual level, but from your family's level? So, you know, um families who have lost their parents at a young age, or who have lost their grandparents maybe at an age where they would have, had they done further prevention, potentially have a longer longevity of life. So the goal, the ultimate goal, is the longevity of life that we're seeking, and what that means for the family that
mhm,
will have you around to give you advice, to for them to, excuse me, for you to give them advice as you become the matriarch or the patriarch of the family, that you will be around to see them go through all these milestones of life, that you will be around to nurture them and support them. That's so important to just yes, we are looking at disease prevention, and ultimately how important it is, how impactful that becomes when it actually translates into longevity of life, and how that impacts your family, which impacts the community. So all of,
mhm.
part of that ecosystem all kind of whittles down to this first little thing about, about prevention. So with that being said, what are for the individual who may not necessarily be cognizant of, oh, what are all the different things that we can do as individual? Um, what are some of the things you think that uh the 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 individual, like you said, before they even enter the office, right? So what are some of the things you think that they can also be doing to help with prevention?
Yes, yes. I think they can be, and I hope this is what you're getting at. They can make healthy food choices, right?
Mm-hmm.
So they can be thinking about the amount of fiber that they're getting per day. They
Mm-hmm.
can be choosing whole foods. So eating fresh fruits and vegetables that have not been processed and packaged in little plastic bags, right? But just getting them from the periphery of the supermarket, right?
Mm-hmm.
Not the aisles in between, but way over on the end, you have that produce section.
Mm-hmm.
Picking those in their most natural state and preparing them with as little pulverizing as possible, right? With as little processing, cooking them at home, right? Not requiring major industrial machines and
Mm-hmm.
packaging and
Mm-hmm.
preservatives.
Mm-hmm.
Um, so again, fruits, vegetables, whole grains, right? So choosing grains that haven't been processed. I talk a lot when I sit in the exam room about, and I use rice as my sort of prototype, right? So the rice comes with a hull, a shell, that's fiber and many other nutrients that are there. And when
Mm-hmm.
we refine it, when we process it, we remove so many of those nutrients, including that fiber.
Mm-hmm.
So making that choice to not choose the soft, melt in your mouth white rice, but to choose the chewy brown rice, to do a
Mm-hmm.
little bit of extra work for the
Mm-hmm.
sake of your body. So we talk
Mm-hmm.
about that. And then we want to achieve balance, right? We want to get that protein and we want to get it from the healthiest sources that we can,
Mm-hmm.
right?
Mm-hmm.
And then exercise, right? So we
Mm-hmm.
talk about choosing to exercise at least 3 hours a week of cardio
Mm-hmm.
starting your day. Some people need to do it in the morning. I'm one of those people.
Right.
It's really difficult. I think that's why we get together so much, Dana, because you and I share that, and we know that about ourselves. That if we exercise in the morning, it's more likely to get done.
Mm-hmm.
So getting that early start is a choice that people can make. And again, I go back to knowing yourself. So it's not
Mm-hmm.
right or wrong to do it in the morning. Maybe you're the person who needs to do it at your lunch break. Maybe you
Mm-hmm.
need to take that walk right before you eat that lunch, or take
Mm-hmm.
that walk after your lunch before you get back to work.
Mm-hmm.
Um, other choices that you can make, I kind of alluded to this around mental health, is
Mm-hmm.
feeding your spirit, feeding your
Mm-hmm.
emotions, right?
Mm-hmm.
By maybe watching that sitcom, right,
Mm-hmm.
from time to time, once or twice a week, or even some people need it every day. That
Mm-hmm.
30 minutes of laughter. Laughter is
Mm-hmm.
a good medicine. Those
Mm-hmm.
are things that really are preventive. I don't know the literature on laughter, but I know that it's biblical, and I'm sure that through the ages, someone has done a study that
Mm-hmm.
has shown that people tend to live longer if they're happier in general, right?
Mm-hmm.
So
Mm-hmm.
so those are some of the things that we can
Mm-hmm.
do even before we enter the doctor's office.
Wow, wow. So we hear about plant-based diet
Mhm.
predominantly,
Predominantly, uh-huh.
not necessarily exclusively, but predominantly plant-based diet, exercise, the 300 minutes, 3 hours, excuse me, 150 minutes.
Yep, 150 minutes or 3
150
hours a week.
minutes, so
Yep,
three
more or
hours per
less.
week,
Uh-huh.
and um, and feeding your spirit. And feeding your spirit through what we choose to put in our minds, right? Just
That's right.
what we
That's
choose to
right.
put in our bodies,
Uh-huh.
and what we choose to do with our body, our movement, and also what we choose to put in our minds. Talk a little bit about, you kind of alluded to relationships, how
Oh, yes.
relationships play a role in this in this goal of health, maintaining proper health and prevention. What are your thoughts on that?
On relationships. Okay. If I can just go back to your last question and just
Hmm.
add in rest, right? Rest
Yes.
is another thing that we can do. And I would um it would it would be wrong of me to not mention that, right? So we need to know our bodies and know what our bodies need in terms of rest. And
Hmm.
I sort of talked about resting your mind by watching that sitcom or doing something funny or doing something fun,
Hmm.
but we also really do need to rest our bodies.
Hmm.
Um, Literature shows that most people need 6 to 8 hours of sleep per night. Some people might need a little bit less than that, and I do find in my very elderly patients that some of them even can go as little as 5 hours and be just fine. But for the
Hmm.
most part, 6 to 8 hours of sleep per night is what
Hmm.
we need, and we should prioritize and get that. That
Hmm.
means turning off the phone, blocking out the screen time. That means having a dark, quiet room and putting aside the cares and worries of the day to get that
Hmm.
rest. So that's back to that last question. And then also back in that question, I talked about caring for the mental health. I would also add caring for the spiritual health, right? So I
Hmm.
know that our listeners come from a diverse array of spiritual backgrounds and are really taking the care of themselves in various ways. But I want to encourage that. So what you read in the morning um, or in the evening, and who you know as your higher power,
Hmm.
don't take that for granted because that's a
Hmm.
part of your overall health and that's a part of prevention.
Hmm.
Dana and I share that we are Christians, so
Hmm.
we rely on a power of God, right? And so some of our listeners may rely on others, and I just want to say that I strongly, strongly believe that that's a part of prevention and a part of health. So moving on to relationships, Dana, I'm glad you asked about relationships because it's so, so important. Um, so paramount, in families, we have our wives and our husbands, we have our children, and it's important that we feel comfortable enough to be vulnerable with these people in our lives, that we share with our husbands, that we share with our wives, and we share with our friends, we share with our sisters, we share with our brothers, where appropriate, so that we're not penning up our feelings and that those feelings are not then turning around and causing our symptoms. And
Hmm.
some symptoms can be psychosomatic and then they're so real, right?
Hmm.
You
Hmm.
know, um, we feel various things in our bodies that are stemming from the anger and the anxiety and the depression that we are having and the grief that we're having. So we
Hmm.
need these relationships to help us to work through um, the pain and the hurt that we've had throughout our
Hmm.
lives.
Hmm. Hmm. So I've always like told patients, you have a positive relationship if after speaking with this person, you feel a sense of optimism and
Mm,
hopefulness, and you feel that your burden has somehow a little lighter. Not that that is the responsibility of that person, but just by nature of your interaction, this is a natural result of that. And so those are the relationships you want to nurture. You want to make sure you stay in
mhm.
touch with this person or these persons, and then the opposite where you feel like you get off the phone or you've had a interaction with someone and then you feel a little off, you feel a little depressed or down, and you just feel like the situation is now really bad, whereas before you thought it was something that you could handle. So these is just your
Yes,
inner voice that we have to pay attention to,
yes.
so the relationship that maybe is not the one that you necessarily need to nurture is the one where you're not feeling too hopeful and optimistic after interacting with that person. And we also have to be careful that we also can be the support for that person when they
Mhm.
when they call us, that we are shedding some sense of hope and optimism, and not making something that's really bad sound really even more heavy and more um, just more dire.
Exactly. I have to agree with you. I would say that when you're going into these interactions and you have these relationships, you want to go in with the expectation, go in, sort of on your guard and ready.
Mhm,
You'll know who you can let your guard down with and who's really going to support you, and
mhm,
you'll know who you're going to be there to support, period.
mhm,
So
mhm,
we all have those quote unquote Debbie Downers in our lives.
mhm, mhm,
And I would say a part of being healthy and promoting health in our own lives and in their lives is going into those interactions knowing that,
mhm,
hey, I'm on the strong side of this relationship. And when
mhm.
we leave here, that no matter what that person says, I won't feel badly and they will feel better. You can keep those interactions brief. You can take charge of those interactions. And I've enjoyed as I've grown being able to do that and being able to recognize when someone
Mhm.
isn't necessarily feeding my spirit.
Oh, that's a
Yeah,
very,
yeah.
very
Or
kind way
filling
of
my bucket when someone's not necessarily filling my bucket. We all know about
right.
that analogy, right?
Right,
Yeah.
right. And I like your recommendation to keep it brief so you're not necessarily cutting them off, though sometimes you may make that decision to do that because you want to give everyone grace. We don't know where they're coming
Yes,
from, um, and
absolutely.
we don't know how we may be a positive influence in their lives. So, but just the recognition, I think, is
Yes.
important.
Yeah.
Just recognizing that is important. So far
Yeah.
we have been having a conversation with Dr. Lorda Bonney, who is my dear friend and also an internal medicine physician who also has a master's in public health and is passionate about patient care. We have been discussing about prevention, medical prevention, and how super important that is, not just for yourself, but also for your family, because of course, it all boils down to longevity of life and improvement in the quality of life, which
Yes.
helps not just you but your family. We talked about having a predominantly plant-based diet. We talked about minimizing or eliminating or minimizing, whatever, however you want to approach it, the processing of the foods that we eat. We talked about physical activity, making sure we're getting at least 150 minutes or 3 hours roughly of moderate physical exercise in on a weekly basis, as well as feeding our mental health, our spiritual health, and also rest and relationships. Did I get it all?
You did, you did. I wanted to come back to something that you
Mm-hmm.
said. It made me think of something. Um, we're talking about really being careful in these relationships and not letting other people pull us down. I want to just come back around to my role as a primary care physician, as an internal
Mm-hmm.
medicine physician. When I go into those encounters each day, I go prepared. I go prepared to hear a lot of heavy things. People are
Mm-hmm.
coming in with all sorts of hurts,
Mm-hmm.
and sometimes the hurts that they feel cause them to interact with their doctor in a way that's not necessarily respectful,
Mm-hmm.
and or in a way that could potentially pull the doctor down.
Mm-hmm.
And the way that I've approached these cases is I go in ready, and I know that patients are hurting, and I'm ready to support them.
Mm-hmm.
And most of the time, I would say probably 99% of the time, those people who've come in not feeling so positive, not feeling so good, they leave feeling better.
Mm-hmm.
And I'm so glad about that. And I think, Dana, you know that as well, right? As Dr. Smith, when you go into that hurting woman who's pregnant and you leave out the room, usually she's feeling better emotionally.
Mm-hmm.
So again, I think what I'm getting at is making that a part of your wellness. Know that you can be the therapist in both your personal and professional life.
Mm-hmm.
And you don't want to do it every day because there's a time for everything. But as physicians, that's something that we are trained to do and that comes from our hearts. So
Mm-hmm.
if you're a patient who's feeling negative and coming in crying to your doctor, that's okay. That is
It's
appropriate. Your
absolutely
doctor is
appropriate.
prepared for that and actually
Absolutely.
feels really good about being able to support you during those times.
Mhm, mhm,
So, as a part of prevention, and
mhm,
I'm not saying this because we want your business, but as a part of prevention, taking those burdens to the appropriate
mhm,
places, like
mhm,
to your primary care's doctor's office
mhm,
or
mhm,
to your therapist's office
mhm,
is the right thing to do
mhm, mhm.
for your wellness to prevent illness and disease in your life.
Absolutely, 100%, 100%. Thank you for making that very important point, for pointing that out. So I
You're
appreciate
welcome.
that. I appreciate that. So we have talked about the personal endeavors that one can do towards the road to prevention, medical prevention. Let's talk about a little bit up your alley, the public health spectra. So, what are some of the policies that play a role in prevention? I know, like for us, we've already, been taught in our training about the power of vaccination. That's
Mhm.
just one of the many, many ways in which systemic societal policies have shaped prevention. For instance, I know like smallpox became eradicated through the process of vaccination. What have you found to be some of the more salient ways in which policies have played a role in prevention, medical prevention?
Yeah, absolutely. I'm glad that you bring this up. And I think what you're getting at is essentially is health policy, right?
Hmm.
There are public health practices and policies
Hmm.
that that at times have taken away personal choice, but have done an amazing job at improving the health of the nation and of the globe, right?
Hmm.
Of us as a people, as humans. And
Hmm.
Dana, you hit it on the nose when you talk about smallpox. You know, I've got a little chart in front of me right here about how vaccines have helped essentially eradicate certain diseases. So um, measles down by more than 99%, pertussis by 97%, polio, we said by 100%. And so I have the list, measles, pertussis, mumps, rubella, smallpox, diphtheria, and polio all significantly decreased. There's some illnesses that we, even as physicians, don't know what they look like
Hmm.
because in our generations, we have not seen them, yet we continue to vaccinate people against them, and we're proud when we can give those vaccines. I think about the tetanus vaccine, and I think about lockjaw. Maybe when we were very young, we saw people who couldn't open their mouths and who were losing weight because of that botulinum toxin that got them. But now, everyone is invited to every 10 years get boosted by a tetanus vaccine that prevents them
Hmm.
from getting that problem. And people dying of tetanus at this point in the US, I think is not heard of.
Hmm.
And it's just been amazing. So, other policies, I think you may have mentioned the seatbelt policy, right? Uh, Death rates from motor vehicle accidents have come down significantly, is my
Hmm.
understanding, because we have enforced the use of seatbelts. Let's
Hmm.
think about smoking, okay, secondhand smoke, right?
Hmm.
So we've all but outlawed smoking, right? I remember in the 1980s and 90s when people had to start going outside of their workplace and were essentially ostracized as smokers, right? It was sad to see that they had been allowed to become addicted by this industry, and then it was their responsibility as individuals to stop smoking on their own. That part wasn't necessarily done perfectly, but nothing is, right? We're all imperfect beings, and the way health policy has come to be is often imperfect as well, but we have to be thankful for the policies that we have and how far we have come, right?
Hmm.
So now the tobacco industry is no longer allowed to advertise to children, right,
Hmm.
the way they had been before, and there are initiatives in place
Hmm.
to really work hard on the vaping industry. to
Mm-hmm.
decrease their advertisement to children and to adults
Mm-hmm.
as well.
Mm-hmm.
And that's where we're going to pause. For now, that is. I'm sure you're eager to hear the rest. So don't forget to subscribe so you get notified as soon as part 2 is out. We're going to dive even deeper. And trust me, you won't want to miss what's coming next. See you then.
Thank you for listening to another episode of Straight Talk with My OBMD podcast. To learn more about this topic, visit our website at myobmd.org. Subscribe to our newsletter, follow us on Facebook and Instagram. I can't wait to spend more time with you on our next episode of Straight Talk with My OBMD.